A very good afternoon and welcome to the session on the topic Myths and Facts of IVF. We are glad to have Dr. Avani among us today to help us understand. The doctor will take us through that more in the session today, so stay tuned. If you have any doubts, any queries, post that on the comment section. We'll take all the questions by the last of the session, so stay tuned till the last. And if you have any queries, please ask our doctors right away, or you can post the comment and we can solve the questions later. So now, doctor, you have the stage.
Yeah. Good afternoon, everyone. Firstly, advance happy new year to everyone. Hope everyone is safe and sound. So, hi, I'm Dr. Avani, Senior Consultant, Apollo Fertility, Kondapur, Hyderabad. Today, I just wanted to talk about IVF, which has been in the recent years. We have seen an increase in the infertility percentage amongst the population. So, first, I want to start with the basics to tell you like what is fertility. Fertility is the ability of a couple to conceive, and when do we call it as infertility? When a couple is trying for 1 year with unprotected intercourse and not able to conceive, it is considered as infertility. So, I just want to briefly tell about when you should visit a fertility clinic. So, if your age is less than 35 years and you're trying from 1 year and still not able to conceive, then you need to visit a fertility specialist and to find out whether everything is fine or not. And if you're above 35 and you're trying, then you have to try for 6 months and consult a doctor. And if you're above 40 or 40 and above, immediately it's better you can consult a doctor. Now, coming to the IVF, in the recent years, all of us or all of you have been listening to this term IVF, which is in vitro fertilization. And here, what happens is the egg and sperm are fertilized outside the body, and the embryo which is formed is placed inside the uterus. So, that is IVF. And who are eligible for IVF? What are the when we consider IVF in couples? So, basically, in men, when there is very low sperm count or there is zero sperm, and these are the common conditions in men where we do IVF, and in women, when the fallopian tube blocks are there, or there is ovarian dysfunction such as PCOD, or severe grade of endometriosis, or in case of unexplained fertility where everything is fine but still not happening, and uh, in women who are age, a number of eggs are decreased. Like in above 35, we see a decrease in the number of eggs in them, and also in IVF can be indicated in women who want to store their eggs, as they want to delay their childbirth, which is known as social egg freezing, and which is become popular nowadays. And also in cancer patients, where because of the radiotherapy, the ovaries would be damaged, and um, the number of eggs would be reduced and the quality would be reduced. So before going for the oncology treatments to freeze the eggs is which is done in IVF. And now I just want to tell briefly about the IVF procedure. Like the gametes such as sperm or egg are microscopic structures, and they can be seen only under the microscope. So uh, a woman, when we are planning for the IVF, you need to come on your second day, and we would do a ultrasound of the pelvis, and we would see whether everything is fine, and blood tests are done. And the gonadotropin injections, they're hormonal injections which are naturally found in the body, are given for 10 to 12 days. And after 4 5 days, a series of scans are done, and whenever the size of the eggs are mature size, we plan the oocyte pickup, which is done under general anesthesia. It's a daycare procedure. And later, after the eggs are retrieved, the and after 3 days of egg retrieval, we know the with the embryo quality and all. Then, if everything is fine, there would be a fresh transfer in the same cycle, or we would the embryos would be stored, and we would plan a frozen embryo transfer. So, uh, now the most common questions which are asked when they come to the clinic is, the first question which I get generally in my practice is, whenever uh, I suggest IVF, the first and foremost thing the couple, husband and wife, want to know is whether the IVF babies are abnormal, or do they have any developmental delays, or do they have any defects, or uh, any other problems you observe with the IVF children, IVF babies. So now, coming to that myth that IVF babies are abnormal, it's in 1977 when the first test tube baby or IVF baby was uh, born, which is Louis Brown. And in the past so many years, 43, 44 years, lot of studies, lot of literature, and lots of um, studies have been done where they have observed the growth and the development of the child from the birth. So the literature and the studies, whatever they have showed us, tell us that there is no difference between the normal babies and the IVF babies, which is a big myth amongst a lot of people, feeling that IVF babies can be abnormal. It is not that case, and they're absolutely fine and as normal as who where babies have conceived normally. And coming to the other myth which I we commonly encounter is that when then is that what the normal couples feel that if they enter a fertility clinic, IVF would be done for them right away. So IVF is a procedure where it is not advised for all the couples who ever come to the fertility clinic. First, when a couple enters the fertility clinic, the detailed history is taken and evaluation is done. Why? What is the problem of for the particular couple who are failing to conceive? And later, the tests are done. Like, what are the routine tests which we do when a couple comes to the clinic? Are like the routine hemoglobin, thyroid, blood sugars, and other fertility hormones, which would determine the number of eggs in the women, and the sperm test for the men, where we would check the count, motility, and morphology of the sperm of the semen analysis. And then an ultrasound is done for the women, where we see the uterus and the ovaries. Any difficulty seen or any pathology seen in the uterus, such as endometrial polyps, or fibroids, or any endometriosis is seen in the scan, or any ovarian cyst or any ovarian pathologies observed. This is all seen in the first visit. And after that, after seeing, evaluating all the tests, if it is required only, as I previously mentioned, the commonest indications where we directly tell for IVF, then only we do IVF. Otherwise, these couples are guided through their fertility path, where timed intercourse is also possible, or IUI also helps the couple. Not every couple who enter the IVF clinic would go for IVF. This is the other thing which I hear from my patients, where they are scared to come into fertility clinics because once they enter, they feel that IVF would be done and it would be suggested. And in the next myth, which is seen as that IVF is a very painful procedure, and it will be very uncomfortable for the patient. No, it is not the case. It is not at all a painful procedure, because it is a the 10 days of injections are very with a very small needle, and they are given subcutaneous route, where the pain is not felt, it's just the prick pain. And it is not that they will stop all their routine work for this IVF procedure. They can come to the clinic, just take the injection and leave for their work. And as the oocyte retrieval is done under anesthesia, there is no pain, and after the procedure also they would not find any pain. So absolutely, IVF is not a very painful procedure where they would be like, it will be very uncomfortable. And one more common myth which is there is, when you undergo an IVF procedure, uh, they feel that the IVF pregnancy or during the IVF, you have to be completely bedridden till the delivery. Uh, it all depends on the condition of the particular person, but overall, you need not be bedridden throughout the pregnancy or throughout the IVF procedure, or even after the embryo transfer. Yes, we would suggest them, do not do an excessive, do not excessively strain yourself. Other than that, they can be normal, and they need not be bedridden after the IVF procedure or during the IVF pregnancy. And it also depends on their situation and condition. Like some women may have short cervix, or any other condition where they are required to take rest. But other than that, in general, you need not take, you're not advised to take complete, and you're not bedridden during the whole journey of IVF or during the pregnancy till delivery. And one more myth which we see is, you can do IVF at any age. So, coming to that point, as we know, as women, we are born with certain number of eggs, and as we age, the number of eggs are coming down. It is a process of aging. So, it all depends on how many number of eggs we have in our body. So, the age, as we age, the success rate can be low depending upon the number of eggs and the quality. So it all depends on the quality of the eggs also when we do IVF. And uh, one more myth we come across is, IVF always leads to multiple births. So now it is not the case, as now we are uh, driving towards more single embryo transfer, as we want a single healthy child who is healthy. So it is not that always you will have multiple births. And is IVF is done only because there is a problem with the female partner? No. So it is not the case. As I previously mentioned, we will be evaluating both the partners, that is male as well as female. And male, we have come across that they have very low sperm count, or sometimes it is zero sperm, or they have some other issue, congenital genetic issue, where there is sperm is zero. So it is not that always it is the only the female partner who has the indication that we do the IVF, but it is we have to evaluate both the partners, where male also may be having serious issues where they would require IVF plus ICSI, that is ICSI. And and is another myth which we come across is weight of the patient or balanced diet does not matter with the IVF success. No, it's not the case. Always, ideal weight is always better for a healthy health as well as the fertility rate, and it's always better to have a balanced diet and exercise regularly so that you'll have a better success. And is IVF treatment very expensive? No, with EMI options and insurance in place, the IVF cycles are not expensive at Apollo. And does IVF guarantee 100% success rate? So now again coming to the success rate, it it always depends on the condition for which we are doing the IVF and ICSI for the couple, because there are, as I mentioned previously, it could be because of the low sperm count or zero sperm count, or the eggs are very less, or the female partner is having severe endometriosis or fibroid, or there is bilateral tubal block. So the success rate and the age of the patient, age and it always depends on the age of the female partner, because it, as I mentioned, age directly is related to the number of eggs we are having in the body and the quality of the eggs. So uh, each individual couple will be having, depending upon their condition, how successful we are in the IVF cycle. Then one more myth which we come across is the medicines which we use for the oocyte retrieval or the stimulation of the eggs will cause cancer in the future. So so no, this is a myth, and these medications have not shown any increase in the rate of cancers among women when they use these medications for IVF purpose or induction of the ovulation purpose. Then, uh, after, if a couple tries one IVF cycle and they have failed, so they have to stop treatments. They cannot go for a second IVF cycle. Uh, no. So depends on why you have failed in the first cycle. That has to be evaluated. We have to recheck ourselves, we have to test again, we have to check where we have missed, what was the quality of the egg, quality of the embryo, and the uterus layer. All these have to be reassessed, and definitely they can go for a second IVF cycle, provided uh, checking all these things. And when we have failed in one cycle, we can always do in-depth tests like genetic testing of the embryos, and also there is a test called ERA where we can assess the timing of the embryo placement, and all these advanced tests can be done and go for a second cycle after evaluating thoroughly, and also uh, evaluating as why we failed in the first place. Then one more common question which we encounter is, if the first pregnancy was an IVF pregnancy, will the second also compulsory require IVF cycle? No. As I previously mentioned, it all depends on for what indication we have done our IVF. If it was for very low count or zero count, or what was the indication in female for which we did IVF. It all depends on that. So it's not compulsory that the second pregnancy also will be IVF, but again, it all comes to the indication and the problems where the couple are facing for the IVF or for the conception. So uh, there is a question where they're telling how much it would cost for the IVF. So again, it all depends on what medications the particular couple would be requiring, and what kind of uh, uh, what is the indication for IVF. So approximately there are many packages at Apollo, so you need to come down to the clinic to find out which would be suitable for you. Okay, we will just leave numbers with you, and you can always talk to us and come to our clinic just to find out regarding, so that we can also find out for what why the IVF is being indicated for you. Okay, as so, any other queries regarding IVF or anything, you can just contact us. And thank you.